ladies and gentlemen. I'm very pleased to join you today to discuss one of the most pressing challenges of our time, certainly one of the triple planetary crises: climate change and its profound impact on local health systems. The theme of today's forum, From Risk to Resilience, Unlocking Climate Financing for Local Health Adaptation, speaks directly to the climate need for action, collaboration, and innovation as we navigate this crisis. This is a timely global discussion, but one that allows me to focus on my country and the African continent. As a known fact, Sierra Leone is among the 10% of countries in the world that are most vulnerable to the adverse consequences of climate change, and presently one of the least able to cope with the effects. For Sierra Leone, climate change is not an abstract threat. It is a lived reality that is affecting every aspect of our development. Rising temperatures and sea levels, shifting rainfall patterns, and more frequent and severe floods are not only degrading our environment, but also undermining our healthcare systems, threatening food security, and exacerbating existing vulnerabilities. In all of these, and as you know, our contribution to this planetary crisis is negligible. In this context, for us, climate equity and justice are at the core of confronting the climate crisis. As a country, Sierra Leone has faced multiple health crises, including Ebola and the more recent global COVID-19 pandemic. We understand the direct link between environmental resilience and health outcomes. Communities on the front lines of climate change are often the same communities that are struggling with fragile health systems. For them, resilience is not just a goal, but a necessity for survival. Often they suffer in silence, since their localized environments' adverse impacts do not make the news. Yet despite this urgent need, there remains a critical gap in climate financing for local health adaptation. Global climate funds, whilst essential, often do not reach those who are most vulnerable. They tend to focus on large-scale projects, overlooking the localized interventions that can have immediate and sustained impacts. This is where we need a paradigm shift. We must ensure that climate financing becomes more accessible, flexible, and responsive to the needs of communities at the local level. As most of you may know, local health adaptation requires funding mechanisms that prioritize prevention, resilience building, and capacity strengthening. We must invest in health infrastructure that can withstand climate shocks, in early warning systems that detect climate-related health risks, and in community-based health programs that address both immediate and long-term needs. In Sierra Leone, we have developed a robust climate change adaptation plan intricately linked to our development agenda. The adaptation plan, inter alia, focused on building resilient health systems capable of withstanding the shocks and stresses of a changing climate, offers hope for a healthier and more secure future. I can boldly declare that Sierra Leone is committed to leading by example. My government is working tirelessly to integrate climate resilience into our health strategies, ensuring that our hospitals, clinics, and health workers are prepared for the challenges ahead. We are committed to strengthening our healthcare infrastructure, enhancing disease surveillance, and ensuring our health policies are climate responsive. But we cannot do this alone. We call on our global partners to join us in unlocking climate finances for the most vulnerable, not as a matter of charity, but as a matter of justice. Our plan and the ambitious goals we have set for ourselves require substantial financial resources. Unlocking climate finance is critical in turning our plans into action. Financial investments that directly support local health adaptation efforts are crucial to ensuring that our communities are equipped to manage the health impacts of climate change. This includes funding for infrastructure, capacity building, and innovative solutions tailored to our specific needs. Distinguished ladies and gentlemen, the case for Sierra Leone is illustrative of the case for Africa. The African continent as a whole has articulated clear expectations and strategies regarding climate adaptation. At the African Union, we have consistently advocated for increased climate financing, emphasizing adaptation. Africa bears a disproportionate burden of climate impacts despite the minimal contribution. It is only fair and just that we receive the necessary support to build resilience. Our expectations are clear. We seek equitable access to climate finances, focusing on adaptation that prioritizes the most vulnerable sectors, such as health. Africa's strategy emphasizes the importance of localizing adaptation efforts, ensuring that communities are at the forefront of decision-making and implementation. We call for the developed countries to honor their commitments and support Africa's adaptation efforts through accessible, predictable, and adequate financing. The time for incremental change is over. We need bold, transformative actions that recognize the inextricable link between climate change and human health. Together, we can move from risk resilience and build a future where every person, regardless of where they live, has access to the health services they need to thrive in a changing climate. Let us therefore seize this moment, harness the power of collaboration, and unlock the resources necessary to build a resilient health system for all, with equity and justice, leaving no one behind. Thank you very much.
Please welcome Pascal Lamy, former Director General of the World Trade